What is epidemiology? Understanding the core concepts in research. This video aims to introduce the core concepts of epidemiology in a simple and engaging way, making it accessible to a broad audience, including beginners in the field of health research. Welcome to my channel. Whether you're new to health research or just curious about how we study diseases and health patterns, today we're breaking down the core concepts of epidemiology, one of the most essential fields in public health research. Let's get started. So, what exactly is epidemiology? In simple terms, epidemiology is the science of understanding how diseases and health conditions spread, who they affect, and how we can control them. Epidemiology helps us answer critical questions like, why do some people get sick while others don't? How can we prevent the spread of diseases? And what factors put people at greater risk? Example, during the COVID-19 pandemic, epidemiologists tracked how the virus spread, studied risk factors, and evaluated the effectiveness of vaccines and other interventions. To understand epidemiology, we need to cover a few key concepts. These are the building blocks of how we study health in populations. Distribution. Epidemiology looks at how diseases or health conditions are distributed across different populations. This includes understanding who is affected, where it happens, and when it occurs. Example, distribution could be studying the rates of heart disease in different age groups or comparing disease rates in different regions. Determinants. These are the factors that influence health, such as behaviors, genetics, environmental exposures, and social conditions. Determinants help us understand the why behind the distribution. Example, smoking is a determinant of lung cancer, while physical activity can be a determinant of better cardiovascular health. Population focus. Epidemiology isn't about studying individual patients, it's about studying groups of people. This population-based approach allows us to identify trends and patterns that individual cases alone wouldn't reveal. Example, instead of focusing on a single person with diabetes, an epidemiologist might study diabetes trends in an entire city to identify risk factors and intervention strategies. Outcomes. Epidemiologists look at a wide range of health outcomes, from infectious diseases to chronic conditions, injuries, and even mental health. The goal is to understand how these outcomes affect populations and how to reduce their impact. Epidemiology is a cornerstone of public health. It plays a critical role in identifying public health problems, guiding interventions, and shaping health policies. Disease surveillance. Epidemiologists constantly monitor the spread of diseases to detect outbreaks early and prevent them from spreading further. This was crucial during the COVID-19 pandemic. Risk factor identification. By studying large populations, epidemiologists can identify risk factors for diseases, like how smoking increases the risk of cancer or how lack of physical activity contributes to heart disease. Evaluating interventions. Epidemiologists assess the effectiveness of public health interventions, such as vaccines, health campaigns, or new medications. They provide the evidence needed to make informed decisions about what works and what doesn't. Epidemiology isn't just about understanding diseases after they happen, it's about using data and research to prevent them from occurring in the first place and improving the overall health of populations. Epidemiologists use different types of studies to investigate health issues. Each type of study serves a specific purpose in understanding diseases and health outcomes. Epidemiology isn't just theoretical, it's incredibly practical. Let's look at some real-world examples of epidemiology in action. Infectious disease control. During the Ebola outbreak in West Africa, epidemiologists worked tirelessly to trace contacts, map the spread of the virus, and develop strategies to contain it. Chronic disease prevention. In the field of chronic diseases, epidemiologists have played a key role in understanding the causes of heart disease, leading to public health campaigns that promote exercise and healthy eating. Environmental health. Epidemiology has been crucial in studying the effects of environmental exposures, like air pollution, on population health. This research has led to policy changes to improve air quality and protect public health. By identifying the causes of health problems and evaluating solutions, epidemiologists have a direct impact on improving lives and preventing disease. So, now you have a better understanding of what epidemiology is and why it's so important in health research. Whether you're interested in disease prevention, health promotion, or policymaking, epidemiology provides the tools to make a real difference. Thanks for watching.